When I was looking through all the different programs, what stood out to me about Mount Sinai was their dedication to health disparities research, which is something I'm super passionate about and wanted to learn more about, so this seemed like the perfect place. I grew up in an immigrant household. In my previous role as an attending, the majority of my patients were Spanish speaking. I would watch them go through the hardships of navigating this difficult system, and I just became really passionate about trying to help them out and see what we can do to make it a little bit easier for them to get the care that they need.
Hospital medicine right now is at the beginning of the field. We have just been accredited by the ACGME for the hospital medicine programs, and we are the newest subspecialty that has been recognized by the American Board of Pediatrics. So we are right on the cutting edge of a whole new subspecialty, and we are just so excited to be able to prepare fellows to be able to enter that world.
Sinai is a truly special place that combines clinical exposure that is as broad and diverse as the largest freestanding children's hospital in the country, yet has the sense of family and support of a mid-sized department. Our department and Children's Hospital sit at the center of the Icahn School of Medicine and Mount Sinai Health System, giving us access to a nearly endless array of academic and clinical resources.
This is a place about learners, and you feel that on rounds, you feel that when you're talking to your mentors, you feel that when you're doing your research. This is a place that loves to cultivate learning on all levels and loves to help prospective learners take their careers to the next level and mentor them to where they want to go.
The fellowship at Mount Sinai is relatively new. Our program, in fact, is relatively new. But it comes from a lot of people who have done pediatric hospital medicine for many years. We have a really robust patient population here. We see nearly every diagnosis you could possibly think of. And we have a strong research and quality improvement group that allows us to move the field forward.
We see anything from pneumonia, bronchiolitis, asthma exacerbations that any pediatric attending would see, all the way to metabolic disorders, to really, really complex heart disorders, complex care patients.
Our fellowship is 2 years long, and our fellows during that time will spend time in the inpatient setting, learning the clinical care of a hospitalized patient, and they'll also spend time in our pediatric ICU, in a pediatric short stay unit. The things that we can do that are a little bit special here are we do have within our system a short stay unit, and all fellows get to see how that sort of intermediate care between emergency room and inpatient care fits into child health. We also have our residents work with our complex care group.
We really, really want to make sure that the fellows feel like they're a part of that community. From day one, you will be a part of an amazing group of pediatric hospitalists, and you will be integrated right into those conversations, into the decision-making.
This program is really flexible, which is one of the main reasons I chose it, and I think I definitely have a place at the table here. My thoughts are always taken seriously. My input has really been listened to. I definitely feel heard, and I feel a part of everything that's going on.
I am proud of the recognition of a number of our 15 subspecialties by U.S. News & World Report in its Best Children's Hospitals rankings, and of our research support from the National Institutes of Health that places us among the top 15 departments of pediatrics in United States medical schools.
I think that at Mount Sinai Kravis Children's Hospital, we offer one of the strongest pediatric fellowships around. We have the expertise of pediatric hospitalists in research, informatics, quality improvement, and you leave this fellowship prepared to be a hospitalist at the largest children's hospitals in the country or a community rural hospital. You can do it all.
This was the right choice. This was absolutely the right choice.